Okay, Chairman, so we're now live on YouTube and we can start the meeting.
Lovely, thank you very much, and good evening everybody. Welcome to the virtual meeting of the Social Care, Housing and Public Health Overview Committee. This meeting is being held virtually, but is also being broadcast simultaneously on the Council's YouTube channel, Hillingdon, London. I'm Councillor Ian Edwards. I'm the chairman of this meeting. Now that we've had the software updated, I'm able to see all the attendees of the meeting, which is helpful. So should you wish to speak, if you just indicate, I can now see that you're indicating. Therefore, we shouldn't need to use the chat function. Okay, a key role of this committee is to monitor the performance of local public services within the remit of the committee and hold reviews on topics of resident interest. We do have witnesses with us tonight, and I am exceedingly grateful to Leanne, Georgia and Aisha for attending. Without the contribution of our witnesses who bring expertise that actually the members don't have, in that you have the experience, we cannot learn from our services, and we cannot hope to get them improved. So I'm really, really grateful for your attendance and contribution. For those present during the meeting and intending to speak, please note that you will be filmed and any statements you make will be recorded and made public. And as Liz has pointed out, does have a habit of having a sidebar of also showing those that have recently spoken. So bear that in mind, please. Even though we're meeting virtually, some housekeeping rules. We may have mobile phones or laptops with us. Please can you make sure they are turned to silent, because they do go off even if you are using them. They can ring. Please keep your microphone muted. We're not speaking. And that is just to help with bandwidth and feedback. We do get interruptions otherwise. I will do my level best to recognize who indicates to speak and to call you in order. Now, we need to do an attendance roll call to indicate that you are all present. So if I call out your name, can you just please indicate your presence for the record? Councillor Ian Edwards.
Good evening, I'm present.
Thank you. Councillor Judith Cooper.
Good evening, present.
Thank you. Councillor Alan DeVille.
Sorry, Chairman, he doesn't appear. I don't think Councillor DeVille has joined us yet.
Okay, that's fine. I'm getting some feedback somewhere from somebody's sound. We need to check.
Yes, there is some feedback. I don't quite know where that's coming from. Councillor Eggington, would you mind just putting yourself on mute, just in case it's coming from there?
It may have been.
That's better. Yeah, that's better. Thank you.
Excellent. Right. Councillor Eggington, having turned you off, can we turn you back on again, please, to announce your presence?
Good evening, I'm present.
Thank you so much. Councillor Janet Gardner.
I'm present.
Thank you. Councillor Becky Hagger.
Good evening, Chair. Present. Thank you.
Thank you. Councillor Paula Rodriguez.
Good evening, Chair. Good evening, everyone. I'm present.
Thank you. Councillor Steve Tupwell.
Good evening, Mr. Chairman. I am present.
Okay, also present are maybe a number of officers. I've been advised that Dan Kennedy is present. Are you with us, Dan?
Good evening, Chairman. I'm present.
Thank you, Dan. Sharon Day.
Good evening, Chairman. I'm present.
Thank you, Sharon. Kevin Byrne. I've not seen. Not to worry.
I don't think he's joined yet, Chairman.
No, that's fine. That's fine. Kate Kelly Talbot.
Good evening.
Kate is
apology.
Yeah.
Thank you. Thank you. Thank you. Liz Penny is Democratic Services and he's with us and keeping us all in line. We do have Leanne Williams with us. Hello. Hello, Leanne.
Hello, I'm present. Thank you.
Thank you. Georgie Bard.
Good evening, Chairman. I'm present.
Thank you, Georgie. And Aisha Richardson Long.
Good evening. I'm present.
Excellent. So not only have we checked everybody's present, but the technical side works.
Chairman, just sorry to interrupt. We did miss off Poppy, I believe.
Oh, Poppy, my apologies. Poppy, ready?
Good evening, Chair. Present.
Yes, you're important tonight, Poppy. You're the lead act on some of it, so thank you. In terms of the technical control of the meeting, because this is a virtual meeting, we do have technical issues every now and then, and councillors can leave the meeting, in inverted commas, when their connection breaks. If this happens, we will continue regardless, unless we get to the stage where the meeting is no longer quorate, and that is 5 councillors. Importantly, any councillor who does leave the meeting for a period of time will not be able to vote on that item that they were not present for. Okay, but I don't think that will be an issue this evening. And details of the business to be considered today is shown on the agenda, copies of which are available on YouTube underneath the broadcast. Okay, now we have, if you just bear with us a little bit, guests, a little bit of our formal agenda to go through. We go through very quickly there before we get into the business. And apologies for absence, and to report the presence of substitute members. Liz.
We haven't received any apologies, but Councillor DeVille hasn't yet joined us.
Thank you very much. Item 2, declarations of interest in matters coming before this meeting. Are there any additional items that have not already been declared, colleagues? No indication. If we can then move to item 3, to receive the minutes of the previous meeting dated the 23rd of September. They should all have been circulated. Are they agreed? No indication of dissent, in which case they're marked as approved. This is to confirm that actually all of this meeting will be held in public. There is no part 2 private. So we're now into item 5, which is the committee review of making the council more autism friendly. Colleagues, this is a useful witness session. We have been joined, as I say, by outside witnesses, which will enhance our knowledge greatly. First of all, we do have a paper. So let us turn over to Poppy, who is going to present this paper on behalf of the team. Thank you.
Good evening, everybody. I can't take all the credit for this paper. It was a joint piece of work with Vikram and myself. Unfortunately, Vikram's not able to be here today. So the first part of it was supposed to be Vikram presenting. So I'm going to pretend to be Vikram this evening. I mean, I hope I can take most of it as read. And if there's any questions, you know, we can then look to see if I can answer any of them. But basically, it just goes through the services that's provided by SEND and the inclusion service. You know, the schools in our area that cater for the young people, and the SEND advisory service, and what support and what they do. You know, being a multidisciplinary service. And specifically, it obviously is looking at autism and what support as a local authority we provide to our residents and our young people with autism. Interesting is the psychological service, which is quite a popular service within the department, and what they actually help and assist with. Is it okay if I then just go straight into the statutory services?
Poppy, we have all read the paper, so you can take it for granted. What I should have done is maybe assist you with by saying it is your opportunity to draw out some key points, anything that you wish to highlight, and there's no expectation that you highlight the whole paper, and you might actually just say, hey, let's go straight to questions. But if there are things that you believe are particularly noteworthy, then you should draw attention to them now. Thank you.
So, you know, I mean, I think my remit is in terms of statutory services and offering support under the statutory guidelines for young people within the community. We obviously take our referrals from our referral team, our early help team, and I think across the service, both in Vikram's service and my service, it's very important that our staff are fully trained And that's what we try to focus on, in making sure that the staff have the adequate training, so they have an understanding of autism, they have an understanding of the behaviours, and they have an understanding of how to help families who are in this position. So we do, the early help service will obviously take the early referrals, and then it gets passed on to the children and disabilities team, which is in my service. We currently have 8 qualified workers and 2 family support workers. Now, the children with disabilities team, apart from holding cases, they also have a role in terms of supporting the other services, supporting other workers, supporting so that we can make informed decisions, so that we're able to get the assessments right, you know, at the first go, as opposed to passing through from one service to another. So we try to have a holistic assessment initially. Because I think one of the most frustrating things is families having to talk to different professionals and outlining the same concerns. So, which is why we offer that level of support across the teams. We obviously will undertake an assessment of need and look at bespoke services that we can offer families based on the need of that particular young person and the need of that particular family. Some of the things that we do in terms of our support is, apart from the statutory social work support and advocacy and guidance, what we do is we look at different communication methods in the way we work with families and the way we talk to children. Some of it includes play, it includes communication boards, visual aids, symbols, drawings, sensory items, and of course now most popularly at the present time is electronic devices, because everybody seems to like to have a go at the tablet, and that actually is very good in terms of the communication between my workers and families and children. And just of note is during the lockdown period, we have provided DFE tablets to our children and families. With this particular cohort, the tablets were more popular, so iPads as opposed to a laptop. We also work very closely with the multidisciplinary network, you know, like partner speech and language, SEND, occupational therapists, schools. So everybody is aware, and it's a common goal, and we're sharing information, and we're looking at the best ways to help these families. Just one example that comes to mind in terms of engagement with families and especially young people with autism is, we know that people with autism do not like change. They don't like unpredictability. It's confusing to them. So this worker actually ensures that when she goes out, she actually uses the same perfume. When she visits, she uses the same color pen and notebook. It's a pink one. Pink is not her favorite color by any means, but that's what the young person likes. You know, and she sits in the same position. So that's a little bit of familiarity that the young person has when she goes and visits. So that's just an example that springs to mind. We then support families with direct payments and agency packages. So basically it's to support carers, young people and parents, so that they can purchase services directly, and it's more bespoke packaged that or what they need as opposed to what we think they need. So it's basically we will be launching our personal budgets policy soon, which is basically an amount of money that we will then give families with children within the borough, and it's self-directed support. So it's aimed at giving them more choice, more flexibility, and more independence in choosing what sort of services best suit that family. And where that's not possible, where they can't, then we look at providing agency support, where we actually broker an agency that will be able to offer support to the young person. The other aspect is short breaks, is where to allow the young person a break, to engage in some enjoyable activity, and also give the main carer a break during that particular time. So it gives them an opportunity to partake in different experiences, to develop different relationships, to develop different friendships, to learn new skills. Basically, it's just some sort of fun activity to engage the young person. And where possible, we do signpost families to mainstream services such as after-school clubs, local play schemes, and youth services, leisure facilities, that offer some additional support to the family. Harrow Mencap has been granted our contract to deliver short breaks for Hillingdon, and the contract actually went live in October. There was a little bit of a delay in it going live. It was supposed to go live in April, but unfortunately we were in the middle of lockdown, and we didn't want to put families were very anxious at that time, and having somebody come into the home or joining clubs and activities, which we took on board, which is why we delayed the actual start date of the contract. So, and they will be providing weekend and holiday activities that can be accessed. So during lockdown, they did assist us by providing a little bit more of a bespoke service to families, which included things like video calls, Zoom activities, sign along and singing and art activities, which was quite popular. But families need the break. So when you have a Zoom activity, you actually have to be in the room with the young person and things like that. So although there was some take up initially, it kind of dwindled towards the end as lockdown continued. We provide respite services, and that's basically overnight breaks. We have one in-house resource, which is Merryfield's Children Resource Service, which is an absolutely incredible resource. And this gives children the opportunity, or young people the opportunity, to have overnight stays, whether it's a night a week or whether it's 2 nights over the weekend or over holidays away from them, but also give the family the time and the break, to recoup and to do other things that they need to do during that time. Then there's a number of community activities that we also access, and I know obviously these hacks and other activities in the community. So we try to make use of as much community resources as possible as well, just so that families have a bit of a choice, so they can choose what they want. The one thing that I think that we will, and I am looking into, is providing, whilst we have respite provisions in terms of the residential, I think the gap is in terms of providing what's generally known as a home-from-home option, or sometimes known as link carers, where we have foster carers that provide the respite. So you actually have respite in a room, and that's in a home, sorry, and that's work in progress. So we're looking at building on that resource, and I think that would actually be really helpful for families and for the young people that we work with. And obviously, well, we work with young people up until the age of 18, and thereafter it is transition into adult services. We actually have quite a good working relationship with the adult service, and we have a transition panel that meet every month. We start presenting young people to the transition panel from the age of 14. And the reason why we do that, although they will technically transition at the age of 18, but then it's for early identification, so that they're on their radar. We're able to have those communications. We're able to put in place, facilitate joint working. And so when at the point of transition, there's a smooth transition for young people, and there's lots of cross-service discussions at that stage. So, and if young people don't meet criteria for transition, then we have a duty to signpost to other activities and other resources within the local authority. If it's a looked after young person, they obviously still remain a looked after young person till 18, but then they qualify for leaving care services up until the age of 25. So they will then have a personal advisor and still have social services involvement up until the age of 25. Unless I'm able to help any further, I'm happy to take any questions.
Thank you, Poppy, for the overview. Councillor Hagger, I've seen you and we'll come to you. Before we go there, could I just ask a general question? With regards to the statutory service for which you're the head of service, how do you assess those services? Do you believe them to be good, average, excellent? How do you benchmark those against other authorities?
I actually think we have a really good provision in place. We get lots of positive feedback from families, but seeing the outcomes of, for young people is what I think we can evaluate ourselves on. So I actually think we have quite a good one, and we're quite competitive in terms of the neighbouring boroughs and things. So we kind of mirror the services.
Okay, and could you share anything with us about expenditure? How much does this cost? How much are we paying on average per head in support of
it's very difficult. It's very difficult to give you an average because it's very much based on the need. So it's based on the young person's need and what. So it could be very different from young person to young. But that's the important part. It's based on individual needs as opposed to a collective.
So you're not capped in terms of expenditure at all. You provide whatever's needed.
Yes.
Okay.
We undertake our assessments, and it's based on the assessment, and we use the resource allocation system, so that we're able to make sure that it is an effective package.
Thank you. And just a couple of questions on the actual demand for these services. Do we meet all the demand, and do we meet it speedily, or is there unmet demand, or are there long waiting lists?
We don't have a waiting list in terms of, so all our young people are allocated. So every young person has an allocated social worker. There's a difference between meeting the eligibility criteria for children with disabilities, but that doesn't mean that the families do not receive a service, because not all young people with disabilities fall under the children with disabilities team, but they still receive a service from the general, from like a child in need plan, from the children's services or early intervention. So that's what I say. It's based very much on need of the young person.
Okay, thank you very much. Councillor Hagger, I invite you for your comments, questions.
Thank you, Chair. Sorry, I just had to unmute everyone. I couldn't allocate my mouse to the mute button. Apologies there for the delay. Good report. So thank you so much for the report. It's always great to read and go through. I would like to see more figures, I think, personally, on what's inclusive in here and what you have included, where we are exactly, as the chairman said, where exactly we are and how our delivery is looking. On page 12, I've come to the chart and I've been looking at the primary need, the ASD need, and then the total. And around that, I couldn't quite understand it or get my head around it a little bit, I'm going to be honest. When we've had this paper before, there's been a couple of concerns that we've had, which has been about the level of need. Has it been addressed? Has it been picked up? And how long we've had to wait for that? So I can see that we've had, on a primary need, it's 2019, is that right? 2019. On the ASD needs, it's 867, and then the total is 2,129. Is that right? Is that the amounts, the year? I couldn't work it out. And it looks like it's gone down, but that again, could you just explain the chart, please?
Councillor Hagar, I'd love to be able to do that, but that is one of that was one of the sections that Vikram was supposed to cover. So it falls very much under his service, and it's something that we will take back so that I can get a response and we'll feed back to the chairs, and I'm sure it'll be circulated to everybody.
Is that okay, Chair, if we can make a note of that?
Councillor, that was already noted. It's been picked up with Liz Penny beforehand, and unfortunately, as we heard, the officer isn't available to answer that tonight. But that chart doesn't appear complete and needs to be.
Thank you. Can I have a supplementary?
Of course you may.
Thank you, Chair. And one of the other things I'd like to know is how our referral system is going onto the educational plan. So one of the issues we've had before is not actually when they hit the plan, but actually trying to get onto the plan has always been a problem. So actually getting onto the plan and being referred to it. Now, I know we've got statutory and a traded referrals. The school does 50% on that, which is good actually, but we still have 50% of schools that aren't taking that up, which isn't good. And the other side of it is when we are referring statutory. So I would like some figures, Chair, around how many people haven't been referred, if we can, and are still waiting. Now, I know we haven't got a waiting list of people who are having who've already got the educational plan, but I'm interested in the before bit. Am I making sense to anyone? I hope.
You are.
Thank you. Thank you.
Maggie, you are. Poppy has explained those that are assessed and passed on to her services. This is how we deal with it. What we really need to do is speak with Akron to say, okay, how's that filter working? What's the data there? Are we confident the criteria is set and judged appropriately? Are we confident we're doing this speedily? All of those sorts of things. And I'm always interested in not only our actual performance, but our performance benchmarks against other authorities. We always seek to be the leading authority. And the only way we'll ever know that we're leading is if we look at what others are doing and compare ourselves against it. So, I've noted, we'll follow that up. Can I invite Councillor Eggington to ask a question?
I will try, Chair. Thank you very much. It's an interesting report. I think I agree with Councillor Hagger that a bit more information. I guess that when she talks about that particular table, it's the date, I guess, which we're talking about there rather than anything else. But there were a couple of questions which I wanted to ask. You may not be able to answer, Poppy, I'm afraid, but it may be for Vikram. The first was related to the supported internships. I noticed that sounds a very good idea, and it's interesting to see that 80% of those who get involved with the supported interns are able to get full-time employment. However, I wasn't quite clear what proportion of these young people actually take up the supported interns. Obviously, if it's a small proportion, then 80%, and they will generally, I guess, be the most able of the young people, 80% may not look as good as the report suggests. And I wonder whether you could answer that point. Another matter was, and I'm sure you'll be able to answer this, is that reference is made at the bottom of page 3 of your report, that's page 13 of the agenda, which talks about ELSA, E-L-S-A. There's no reference to actually what that means or what it involves, and I wonder whether you'd be able to supply information about that, please.
Unfortunately, that's again part of Vikram's remit. Had I known that I was going to present the entire report less than 1 minute before, I would have actually gone and looked into it. Can I take that back to Vikram as well, please?
Yes.
That's very kind, thank you.
Yeah, of course, Poppy, please don't feel any embarrassment about this. We know that this happened at the last moment through circumstances well beyond your control. All you need to do is listen to those sorts of issues and say you will take them back. Liz and I are taking a note here, and we will be asking a list of questions that you are unable to answer tonight. So please don't feel awkward about that. Okay, Councillor Mahwane, your questions, if you please.
Thank you, Chair. Actually, Councillor Egginson asked the same question that I was about ELSA, so thank you.
Thank you. And it was in my thinking as well. I have a number down there. Councillor Gardner, you're indicating?
Yes, I'm going on to the actual report, page 18, in terms of reference. It says to understand the different types of autism and how residents' lives can be impacted by autism. And what I would like, if possible, to have some sort of, it's going to be quite difficult, have some sort of graph which shows the wide variety of behaviours that people with autism suffer from, because since from some things that I've probably said previously, Councillor Edwards, you know that I'm dealing with some people who've got it on the extreme scale, but then you've also got, and I can remember Councillor Rodriguez saying this originally a few meetings ago, well, a lot of children, when they're misbehaving, they may be autistic, but the general population just think they're being a nuisance or not, or being uncontrolled by their parents. I just wonder if we can have some sort of, I don't know whether it's, like some of those round things that have different sections to. I can't think of another way of describing it.
Councillor Garden, we will look into that. I will take that back with Liz to see how we can provide further clarity on this. I had rather hoped that the training programme that we'd all done had given us an understanding of the range of autism, but we will look and see if there are clearer documentation around it that's recognised. So we'll take that one back for you. Yes.
Can I have a supplementary as well?
Of course you can. Go ahead, please.
I've gone through this quite a bit. I haven't seen anything where, in terms of parents are helped, benefit system. At the moment, several people I know are having problems getting PIP for their children, and they're having to go to the Citizens Advice Bureau to get help, which the Citizens Advice Bureau are not quite sure how to deal with things. So do we provide any sort of benefits advice, telling them who to go to see? Basically, I mean, also a lot of the mums that I'm dealing with have problems admitting that their children have got problems, not to other people that they know, but to strangers. So I'm wondering how we can get around that one, because there's still a lot of stigma attached to it.
Sorry. Yes, Poppy, can I ask, are you aware that in our one-stop shop approach, are we able to provide information on the benefits to families with members who have autism?
Yes, we do. And if I'm looking more from a statutory perspective, we actually do have somebody from the benefits that's co-located in Hillingdon. Well, we had before COVID-19, before March, and obviously that's just put a bit of a stop on the situation. Although it's specifically linked to our leaving care service, so it is offering services and advice and guidance to our leaving care cohort. We can approach them for advice and support, so they can direct social workers into how to help families and to provide advice and guidance, especially around the benefits, because there's lots of queries and what's the best way to access the benefits.
Thank you very much for that, Poppy. Colleagues, are there any other members wish to ask questions at this point? Councillor Tuckwell, thank you for your indication. Over to you.
Thank you, Mr. Chairman, and thank you, Poppy, for sharing the report this evening. There's a couple of points I'd like to pick up, and it's in relation to the educational healthcare plans for the young people. Two points to this really is, how are these care plans monitored? And how do we work with parents to sort of get feedback to make sure that they're on track and being followed by all the parties concerned?
Okay. In terms of how they monitor, they are reviewed annually. So there is a sit-down meeting where you review the education healthcare plan, and it's all the role players, all participants sitting down and looking at the plan and making sure it is appropriate and it's meeting the current need. And if there's any change in needs, to include that in it.
Can I just have a follow-up on that,
Please,
Mr. Chairman?
carry on. Yep.
So I suppose the follow-up, Poppy, to that is, if there's a problem indicated or we're off track on a particular care plan, and what kind of interventions do we put in place to get back on track?
I'm not sure if I'm understanding the question correctly, but I guess what you're asking me is that if, whilst on the HCP, we identify that there's an issue and or additional support is needed, and how we address that.
That's correct, yeah.
Is that the question? Well, very similarly, that's the purpose of reviewing the educational healthcare plan. It is to see what additional support can be, or whether it's needed, and how that needs can be met. And if the first part of it talks about the services that's been offered, the advisory service, whether we need to consider what else needs to go in.
Okay. Any further questions from colleagues? Councillor Judith Cooper.
Thank you, Chairman, and thank you, Poppy. I'm at the top of page 12 or page 2 on your report, and you're talking about currently exploring additional resource provision within secondary settings. Well, now, I wonder, what additional resources do you have in mind, and with whom have you or are you consulting over any potential gaps in the provisions that you find? And I wonder, how are those people's views being addressed by you? Is that enough?
It is enough, and that's another question I'm going to ask if I could take back, please. But in terms of, I know Vikram chairs a special schools meeting once a month, and part of that meeting is where we actually look at what additional resources are needed, for how we can help the schools to meet their requirements and to support the young people in the team. But that's something that I think I'd need to take back.
Okay, thank you. We'll note that and take that back. Any further question, Councillor Cooper? No, I see you've muted yourself, so I take that as a right. There have been no other councillors, members indicating a question. Let's turn now to our witnesses. Are there issues that would like to be clarified at all? Councillor Garner, I ask you to mute, please. Thank you. Georgie, you were indicating that you might want to say something at this point. I mean, I will be inviting each of you to actually speak to us about your experiences, but you may wish to ask a question at this time.
I was just kind of going to say to Councillor Tuckwell, the situation with education, health and care plans. Myself and Aisha have children with the plans, and obviously have those yearly annual reviews. Was going to give Poppy a bit of a hand of explaining that kind of process with provision and outcomes. So there's certain things in the plan that you're working towards, and when you have your annual review, you can then see whether those sort of things are happening or not.
Thank you for that added comment there around that particular issue. Now, if we just turn generally to your experiences, that's helpful, because often as councillors, we hear from people when it goes wrong. We don't tend to hear from people when it goes right. And if we're not careful, we get a sort of jaundiced view on what happens, because the only things we hear about are problems. So it would be really nice to hear from you about your experiences, about where you think we do well and where you think we could do better. And if you think that there are gaps, then I'd like to hear about that. I'm not saying that we can fill them, but it would be helpful to understand them. So, Georgie, if I could invite you first, just because you were there on my screen, I'll leave it for you.
Okay. I think, firstly, the important thing to say is, as part of the Hillingdon Parent Carers Forum, we are basically a small steering group to harvest the voice of the parents of Hillingdon who are obviously have children with special education needs and disabilities. So our voice is our opinion, but what we do through the forum is we'll harvest that voice. So we will often go out to the parents with surveys and questions to hopefully feed that back to the local authority and bring back the, sorry, my son's just walked in the room. Okay, thank you. Perfect. Sorry. So that's one thing to say. Of course, I'm happy to give my opinion, living and breathing it day in, day out, but that will only ever be my opinion, and I can't stand and say that's the whole of the Hillingdon Parent Carer Forum. So that's something I think is always important to kind of put out there. And we're more than happy as a forum to put out those questions as often as possible to get as much of that, because like you said, everyone has very different situations. And I think we do often hear that negative. We're very quick to say when something's not working and it's not right. And and it's going okay. I think because the other thing I find with parents of children with special needs, if going well, sometimes you just very quiet. If it's not broke, you know, don't go near it in case it does. Yes, thank you, Zach. So yeah, so I think you're absolutely right about the not always hearing the positives. I can't give any kind of experience around the social service side of so the care support. We don't meet that criteria. So I think for parents, we do find that the criteria is quite high to meet. My youngest is at a special school, but he has moderate learning needs and he doesn't meet the criteria for any of those additional support. We do obviously have things in the borough like breaks, which is something that we can pay to have some services that are subsidised by him. The kind of support that Poppy was talking a lot about, I wouldn't be able to give kind of my views on that because we don't meet that. He does obviously have an education, health and care plan, so we have that service and we go through that, the annual reviews, and obviously he's had it for quite some years, so my experience on that is quite different to maybe someone going through it now. I know there's a lot of people in the borough. I know we are quite there's a lot of restrictions on everything, you know, every service. There's so many people now and we're needing so much. So I think there is a lot of impact on that in Hillingdon, but probably in all boroughs. Things like waiting lists for just to be diagnosed with autism, things like that's very difficult. EHCPs, obviously, you've got to meet the criteria and that's quite difficult sometimes, but there's lots of other things involved in that area as well.
Georgie, can I ask? I don't understand a lot of the world here in the level of detail you do. So when you talk around the criteria, are you talking about local criteria or national criteria? Or are you talking about our interpretation of national criteria? I mean, what exactly is it? Because anybody can write a set of rules and they can be applied in many different ways.
I think it depends on what we're talking about. So something like education, health and care plans has a very different criteria to something like the children with disabilities team criteria for services that they provide. So I think individual boroughs have their criteria, but I mean, Poppy, tell me if I'm wrong. I think it is kind of followed, it does follow government, obviously, guidelines, but we have our own kind of criteria. For education, health and care plans, it's very much about what the school has done first. So there is criteria there and funding already being used by the school. And that's what they look at in that side of things, whether the panel can see that school have done everything with the funding they already have before it comes to that step of asking for the additional funding through an education, health and care plan.
Can I just then quickly ask Poppy for her comments around the criteria and to help me and maybe colleagues as well to understand what criteria we're talking about and how the council apply them?
It's very much, as Georgia said, it is based on guidance from the government guidance and government criteria. And, you know, sometimes we might offer a little bit more than what the baseline of the criteria is, but it's very much based on that. And you know, in terms of what the Act says as well.
Sorry, I keep forgetting about this mute. It becomes awkward. I think then, Liz, could we make a note then, please, to just please ask to see the criteria and maybe to compare them with some of our neighbouring boroughs to see, you know, how we fit in terms of our assessment and our gateways into these additional services. I think that will be helpful to me. Okay.
Yep, that's fine. I can arrange that.
Thank you, Liz. Thank you, Georgie. Please feel free to contribute more. Leanne, if I could now invite you to share with us your experience and observations, please.
Hello, nice to see everyone. I've just, while I'm here, earlier you was mentioning not knowing what the ELSA was. I can't pretend that I know all of it, but I can tell you it's a training package that our EP service putting on emotional literary support assistance in school. So it's about the LSAs in school and the training that can be given to them by the local authority. We were talking about positives. Okay, I'm going to be completely honest, and it's a little bit difficult for us with the parent carers forum, but also working with Sendias, like Georgie said, a lot of the time we only hear the negatives. But on the grounds of positive, I wanted to say actually that is something I believe we are doing well as a local authority. Our EP service, the SAS service, or sorry, an advisory service that we have for schools and the ASD specialists. When we manage to get them into a school, the support is amazing for children with ASD, especially when they may not be meeting the criteria we're talking about for that level of support at Poppy's side.
Yeah.
So yeah, I wanted to say that as a positive. I see that quite a lot.
Sorry, I was just saying thank you. It's nice to understand that the service we provide is good. An issue may be access to the service.
Yeah.
I understand that.
Yeah, I mean, speaking along those lines, I'd be really interested. I mean, that graph, I understand why we're struggling with that. I would personally be interested in knowing the number of ASD students, the number that access Poppy service, and the number of ASD students that are a level that need EHCPs. So it's, those type of figures and numbers are really interesting on the different levels, because not all ASD children are the same, and it's about differentiating our services, I suppose.
Yeah.
So I would be really interested in that. Sorry, Poppy, it's another one. Yeah, I was going to talk about the annual reviews, but Georgie's done that. Short
break. Do you believe annual reviews are good, timely, effective?
I'm going to reiterate what Georgie said, and it's difficult for me to offer that without it being totally opinionated, because obviously when parents come to us, a lot of the time it's when they feel things aren't going well. I can tell you that I believe a lot of our schools do a remarkable job of following the statutory guidance, doing them in a timely manner. The paperwork is awesome. I'm not going to lie to you and tell you that that's every school in the borough.
Okay, so my question would be, where things go wrong, how confident is the forum that there are the systems and processes in place to escalate it in a way that puts things right speedily?
I think speedily might be the word we have an issue with at the moment.
You should have been a politician.
Sorry. Yeah. You get there sometimes in the end, but yes, speedily I would say is the issue with, but everyone's under a lot of, pressure, and it's not always as easy, I suppose, as it would seem.
No. And I'm really grateful for the understanding in the forum, because we do live in a world where there aren't limitless resources. No. We love the case that we could give everybody everything they wanted.
Absolutely.
That can't happen. There has to be a process, but we need to ensure that when we make decisions, if we make a wrong decision or it needs to be appealed or challenged, that the forum is confident that there are the systems and processes in place for that to happen, and happen in a transparent way and happen speedily. I don't mean to say the outcome will change, because sometimes but there needs to be that assurance, and I get that. Yeah, the system's there, but maybe not the speed
at the moment.
Okay, thank you. That's really helpful. And I cut across you there, Leanne, and I'm sorry. So please share with us anything else you wish.
No. To be fair, I made several notes. I was sort of expecting quite a lot of questions, but actually most of them have been covered, so I'm quite pleased. But thank you for inviting us.
Oh, don't worry, you might have 101 questions yet, because the members might start coming back and saying, please expand a little bit more here. So let's now turn to Aisha and say, Aisha, please can you share your take on our performance in this field, and where you think we need to get better?
Hi, yes. So like Georgie, I do have special needs children, I have two, but I am also new to the educational health plan. I've just secured one for my son. I can say, although it is personal, my personal opinion again, like Georgie, we don't meet the target, sorry, not the target, the, what's the word, sorry. Don't meet the criteria, sorry, I apologise. Criteria for the extra help that Poppy was mentioning. My children are not, don't have those, don't meet the criteria. So I can say from my experience with regards to the educational health plan and the annual review, I've only had my first one with my daughter, which was last year. And I can say that with her moving into the special school, because both my children are in special schools, the support there was fantastic, I have to say. And with my son moving into special needs school this year, actually, I managed to secure the educational health plan while in COVID, so that was amazing. And I have to say, actually, it was really positive. My experience before was unfortunately negative, but we are, going on the positive this year. My son's a changed person, I have to admit. It was fantastic. And the support that he has got, and the fact that my child is now getting education is a massive thing. I do think you're asking where it's lacking, and if I'm absolutely honest with you, when a child is first diagnosed, I do believe, and that's why I contacted the SEND department, that parents need a lot of guidance and help, because often what happens is that we're left to just deal with everything. And unfortunately, a lot of people that I've spoken to, and myself included, end up having a breakdown, because it's an awful lot, unfortunately, to deal with yourself. So I think if you're asking where it's lacking, I think that would be one of the main things that I can say for myself, speaking for myself and people that other mums and dads that I've spoken to, because that support is needed, and then things don't tend to get worse in the future, because you have that support immediately when your child's diagnosed. But yeah, I can't really comment on some of those things, but that Poppy was mentioning, because obviously, like I said, with regards to that, I haven't experienced them myself. I have had early intervention. Again, I think they were fabulous for us. Those services were great, but I would like to see some more support, because we don't meet that criteria, because my children don't. That means that I feel that my children miss out on activities, on things that they could be doing, because they don't meet, because we don't meet that criteria. So maybe some more support could be, or some more activities, things that children who can't get into those activities and those services, maybe something like that different could be put in place for children like mine and Georgie's.
Yeah, I'm not good. Thank you, Aisha. It's interesting to share that, and I'd like, if I could, to just probe a little bit more about your journey from the diagnosis. I imagine that is in itself a big hit, and
Which one?
Well, the first one, the second one, they just take some getting used to. How did you know who to turn to? And when you turned to the council, did you get the information that you felt was perfect? Just what I wanted. I'm safe. I know where to go now. Be honest.
Oh, sorry, I didn't get the last bit there. Sorry.
No,
who did I
when you did eventually turn to the council, and I don't know at what stage, or whether it was your first thought, or how you made it, did you receive the information, advice and guidance that made you feel, great, I have somebody with me, I'm okay now?
Unfortunately, it's a no, I didn't.
That's fine.
My first support was from Sendias, if I'm honest. So it took a long time to find the right resources. I had some paperwork handed to me at the CDC with some agents, some support groups. I called up, but obviously, as I said, it was a traumatic sort of time, because you get told that your daughter has this, and this. And then they say, don't forget to, get your benefits that the child needs, but you have no idea, and you get all this paperwork which explains what's actually wrong with your daughter, but it needs to be in layman terms, because obviously I don't understand some of what the doctor was saying. And it's sort of, I just felt at that point, well, I had a breakdown, unfortunately, just because it was a lot to get through. It took me sort of 10 years to get her diagnosed, which was a lot, and it had to get, unfortunately, really bad for my daughter. Just that in this instance, she was self-harming, so unfortunately it got really bad in order for me to get the diagnosis. It didn't go like that with my son, so like I said, unfortunately it was negative, but Sendias were absolutely amazing. I can't fault them. They've been a rock to me, really, and that was the most positive. And then we had early intervention, which were helpful, but I got told that unfortunately they could only take me so far, and then after that we were then sent back into, because my daughter got taken into a special needs school. We then got the support through the school. So we were taken off, they let us go, the early intervention, because they said they didn't know how else to help me. And I just got all my support through Sendias.
Okay. Can I ask Leanne and Georgie then, who are part of, I understand they're part of Sendias, I could be wrong, but I understand that. When parents first turn to the organisation for help, how do you link them in with the council? Do you think it's right that they needed to be linked in at that stage, or is that something separate? Is this a part of the process that's working well or not so well?
I think, I don't know if Georgie will agree. I think that's quite a difficult question to answer, because we're a statutory service. All local authorities, as you probably know, have to have IAS services, so information, advice, support. When parents come to us, as a rule, generally it's because things aren't going quite as smoothly, or they just need a little bit of advice. Our role is quite difficult to depict and to pin down. So actually, if a parent has to come to us around services that they're not receiving, then no, that's something isn't working well. The fact that they're getting guided to us is a really big benefit, and the fact that they're being guided to us through schools even and the CDC is brilliant, because that's absolutely what should be happening. But the level of support that we would give for a parent like Aisha and many of our parents is probably far greater than they should need within the realm of what we're supposed to offer as a local authority. Sorry, I can't hear you. You're on mute.
Of course you can't, because I'm on mute. Sorry. Thank you. That is helpful. It's just trying to understand in quite a complex picture, on a journey that I've not had to go down, how this all works, and how does a parent who has this shock and additional demand and a need for help and support and understanding get it. And you've provided that answer. And then when you can't provide that, whether the link into the council in services that the council provide is strong, robust, speedy. And you were saying that by and large, we're doing okay in that. Always room for improvement, I accept. Yep. Okay. Colleagues, are there questions that colleagues, members would like to ask our witnesses here? Because I've hogged a lot of the airtime. Councillor Heggie, you've indicated, please.
Thank you, Chair, and thank you to three of you putting your points of view across. I know it can seem a bit difficult when you're sitting there and trying to be counter-objective too, but we really, really appreciate it, so thank you. I think what I'm interested in, and I have had experience behind this myself, is actually, from what I can hear, is actually just accessing it. And for those that fall what I would call just under the spectrum, so they're in mainstream school, but we're aware, obviously, as we've looked in the report, only 50% of the schools have got that service in. And I'd like to know from you guys how we can encourage the schools to actually use the service. How can we get an increase from the 50%? That's the first thing. If you've got any ideas on that. And perhaps the second thing is, because it's mainstream, I know from experience, when you get into the special needs schools, they're amazing, right? They are really good, and we have got an incredible set in the borough. We should be very, very proud of the schools we've got in the borough on special needs. We really excel. I believe anyway, but we really excel. I think it's just how we're managing in our normal schools with the children that do fall under the radar. And if there's anything you can give us that would be really advantageous to this committee on what we could do. Thank you, Chair.
I'm happy to jump in here. Muted.
Please, Georgie, go. I'll leave myself unmuted.
Okay. I think I'd just like to say there's a few kind of areas, Councillor Haggard, that I'm not sure. So it could be, do you mean under the radar with diagnosis, or when you talk about accessing the service, do you mean the education, health and care plans, or social service, children with disabilities team, or?
Yeah, both really, Georgie, because I think there's a comparable line with both of those. So the ones that do hit and ones that don't, because I'm very much aware that actually to get a healthcare plan is really hard, and to hit that level is really hard. And I'm listening to you guys, and it takes a few years to get there, and if you've got to know what you're doing to get on it. And
can do,
yeah, it's how we do that.
It kind of depends. I think I think the biggest, and the thing is, I don't know if everyone is aware of the SENDIAS role and the Hillingdon parent carer role. So I have experience of the Hillingdon parent carer role for about 7 or 8 years now. But from doing that, being a parent of a child with autism, and my brother also has autism, I was involved in that. But from that, I started this job, which is information, advice and support, an impartial team that Leanne spoke about. So we here, I can tell you my experience as a parent, but also kind of I have that experience of people coming to us through SENDIAS. I now know as a parent, when my son was diagnosed, one of the first things I thought was, oh, now I need to get an EHCP. It was a statement then. I need to get a statement. I need to be able to, this is what has to happen. And actually now, especially now with my role, that isn't what has to happen. There's a lot of things that schools really have to do for children. They have funding, they have SEND support fund that they need to use to support these young people. And one of the biggest issues I think with autism is that it is a very wide spectrum, and there's so many children with differing needs. Some of them will have very extremes and really need a particular amount of support. Some will be seen quite mild, but actually their certain needs might be incredibly high and affected. So they may need something you expect. And I do think more and more people are understanding autism, but sometimes the more and more times you listen to someone and they say, oh, I know because my son's dog's cousin's got autism, I know all about it. Actually, it makes it even harder because they are so different, that you're then being told, I know how to deal with that. Well, I mean, my son and my brother both autistic. I wouldn't dare say that I could deal with someone else's autistic child because I wouldn't have a clue. It's all individual. And I think that I understand is obviously very, very difficult for schools. I don't know how you put things in place to cover all of those different children and spectrum and needs. But I do think that if we can get a better handle on that, we will find that parents are not desperately needing something like an EHCP, because what they're really saying when they come to us is, it's not okay, everything's not okay. If their child was going into school and there were no issues at all, they wouldn't be saying, I need to go through this 20-week process of a legal document that I then have to have reviewed every year. It's used to be looked at as the golden ticket. Parents, I don't think, really see it as a golden ticket. What they hope for is some leverage to get something that their child needs, and they're almost at a loss sometimes of how to do that. They know their child is very unhappy or very uncomfortable, or the square peg in the round hole, and they don't know what it will take to make that okay for them. And it's often that thought, if I get that EHCP, that will make it all better. But actually, if we can do things right before that, and in those stages before in the schools, we shouldn't be needing that so much, because it would already be, the impact would be lessened on them, and we would have a different situation. But again, the understanding around autism is, I understand it's very difficult. I think sometimes if you haven't lived it, you might never quite get it. It is very difficult to understand how all these young people are struggling, and what they need, and what should be put in place for them, I think.
Yeah, that's really helpful, Georgie, to put in there. Councillor Garner?
I was quite upset to hear Aisha saying that she'd had a breakdown. Was there any support available for you? Did anybody say, as the build-up while the child was getting assessed, did anybody say, how are you keeping? Because that worries me quite a lot, because some of the people that I speak to, sorry, it's all right, don't worry. Was there any help available for you? Did anybody take you into consideration?
Aisha, I think
no, unfortunately. Yes.
Okay.
Yeah, could you hear me?
Yeah, we can now. Sorry, I was cutting across you.
Yeah, it's okay, no worries. Yeah, unfortunately, not at that time. As I said, I went to my doctors and just explained what was happening, and I got myself some cognitive behavioural therapy. So I did sort of self-help. They did offer me, the doctors, what the doctors do, offer you antidepressants, blah, blah, blah. But with regards to the borough, unfortunately, no, there was no help for me. And I did stress when I spoke to the early intervention that they said to me that it's just for my daughter, and that they couldn't help me personally. So unfortunately, no, I didn't, there was no help for me. Sorry, I don't like to be negative, sorry, but that was my personal experience.
Aisha, you're not being negative there. You're actually helping us. You've been positive by saying, look, these are areas where you could get better. You do well as a council, but to be an even better council, think about this. So you're not being negative. You're really not. You've been helpful, been positive. Okay?
Thank you for that, Aisha. Thank you.
Colleagues, any other questions? I'm mindful of the hour and the rest of the business we have to get through. And also, we're taking up the evenings of our guests that have been great, our witnesses. I see no other indication. So, Leanne, Georgia and Aisha, thank you so much for your contribution. It has been insightful and helpful. Without the contribution of people who use our services, we actually otherwise are just looking at ourselves, and that doesn't really deliver much. So great, thank you very much for your time. It is a public meeting, so I mean, I don't know what the rules are about kicking you off, because you could just get onto YouTube, but I don't know that you necessarily want to sit and listen to about COVID-19. I think we're all a bit fed up with hearing about that. So thank you, and if you log off, that's understandable. And we're now going to turn, please, colleagues, to the next agenda item, which is agenda item 6, the COVID-19 local outbreak control plan. And we have Dan Kennedy and Kevin Byrne, I believe, present to talk on that one.
Thank you, Chairman. I'll give sort of an overview, and then I'll ask Kevin Byrne and also Sharon Day to add anything that they'd like to as well. So you'll all be, as members of the committee, you'll all be aware that that as a nation, and really along with other countries across the world, we've suffered from the effects of coronavirus. And just to sort of recap, really, earlier this year, we were subject to a national lockdown by central government in an attempt to try to reduce infection rates, which did actually bring down infection rates quite sharply and to a low level. But as part of the sort of easing of restrictions, all local authorities were required to prepare something called a COVID-19 local outbreak control plan. And in a nutshell, the purpose of the plan is to set out actions to try to prevent and also contain the spread of the virus. Now, our plan was completed on time by the 30th of June, and it's published on the council website. And you've got a copy, committee members, in your agenda pack tonight. Now, obviously, a lot has happened since the 30th of June when the plan was published, and so what we're seeing now is rising infection rates in different parts of the country, and obviously you'll also be aware that within the last week, London has been designated tier 2 of 3 COVID alert infection levels, which means that we're at the high level, which brings with it some extra restrictions, such as households not mixing indoors, for example. So what I'll do, though, is rather than go through the report, because I'll assume that committee members have read that, I'll pick out some highlights, because there might, where I anticipate there might be particular areas of sort of questions or interest. So the first is I suppose is that our sort of corporate resilience, and we've clearly been doing a lot, obviously keeping members up to date since the really wave one. But what we've done, our approach in the council has been to mobilise managers and staff right across the council. So we haven't placed the responsibilities onto one team, but we've actually sought senior management and manager and staff input right across the council. So, for example, one of the things that we've provided is sort of food deliveries during wave one, and actually we mobilised staff from different teams right across the council to manage that. Another key and important aspect of our plan has been testing. Now, again, stating the obvious, obviously, if we can arrange a really quick testing regime, it means that anyone who has the infection, particularly those who are asymptomatic, that is, they don't show any symptoms, they can obviously self-isolate, and that can help to spread or contain the spread of the virus. So we've got some dedicated testing capacity across the borough. More recently, so we've got 3 testing sites, but more recently we've just added the 3rd one at Brunel University. That's in place 7 days a week, and it's there until at least the end of March. Now we've chosen that site for obvious reasons, because it does mean that I mean, the students, as we've all seen across on the news in the last month, we've seen higher infection rates among that cohort. So it does mean then that those students, that community, can access a quick test. The other important point about testing is the care settings testing as well. Now, in terms of care settings, staff and residents are tested regularly, and any staff or resident showing having tested positive will obviously be subject to the usual isolation rules. Our testing rate is as a result of the arrangements we have in place is pretty good. We're producing churning out about 350 tests a day, typically per 100,000.
Your audio's breaking up, Dan.
It's probably the order of about 1,000 tests a day, and that puts us in roughly the 3rd highest in London, which is pretty good. Some other quick.
I'm sorry, I'm going to have to just ask.
Okay, can you hear me now?
Can I just ask you to go back over?
Is that better? Okay, I'll carry on to tell me
the testing.
Me. So the other area is. Okay, so I was Of course. So apologies for that. I'm not sure. I think I must have a sort of poor connection. This better now. So testing, we've as part of our strategy, we've increased testing quite considerably. We've got 3 test sites. The more recent one has been placed at Brunel University. That's there 7 days a week. We have a high test rate in London. We're about the 3rd highest in London. So what it does mean, though, that anyone who has got this can obviously get this very quickly and take necessary to isolate and prevent. Whereas PPE, personal protective equipment, has been really important. Government have now made that available freely to local authorities, and we're coordinating the distribution of PPE.
Chairman, sorry to interrupt you. Would it be possible for Dan to possibly
care settings
to perhaps leave the meeting and rejoin, because whether that might improve his connection? It might be worth a try, because it's really breaking up.
I was just going to ask Dan to do just that, because he is breaking up and we can't understand what is being said. So he has done good. He's heard us. Let's just wait. Poppy, whilst we're here, I've noticed you're still here. There's no obligation for you to remain in the meeting as your agenda items completed. You may, of course, continue to remain if you're interested in this important subject. We'll give it a couple of minutes.
Hi, I'm back in the room. I hope everyone can hear me now.
Welcome, Dan. It's nice to hear you again. Yes, we can. We got up to the testing 3rd highest in London.
Okay, I'm so sorry about that. I hope I'm a bit clearer now.
You are a lot clearer.
Thank you. Okay, so I was just about to start on personal protective equipment, PPE, and just to say that government have provided local authorities with PPE for distribution to care providers and other key providers, such as housing settings as well. So what that's meant is that we've got a good supply of PPE and we've got good arrangements in place to make sure that that is provided to care settings. The other area of a part of our plan is enforcement around the hospitality sector, licensed premises. So our licensing team, working with our antisocial behaviour team, have been undertaking unannounced visits to premises, particularly at the weekend. And it's been and just to be clear, it's been a supportive approach, because we want our businesses to get it right, to protect their staff, to protect our residents. And so we've been checking for things such as, I'm sure you'll be aware of these QR codes, for example. So when you go into premises, you're supposed to scan in, and also it's table service only. So we've, for example, in some premises, and so where we've seen that things haven't been working out, we've issued a verbal warning, and then we've undertaken a follow-up visit. And if we've seen that there hasn't been compliance, there's then be a written warning. And then finally, on a follow-up visit, if there hasn't been compliance, then we'll issue a fixed penalty notice. I'm pleased to say that there has been good compliance, and nearly all businesses have been very responsive to the advice that we've been given. I suppose just finally, I wanted to talk about track and trace. And we are setting up our own local track and trace service, working with Public Health England. We've got permission to do that. Staff are in the process of being trained, and we are hoping to go live in November.
Excellent.
So I hope that's some of the updates, and perhaps I've mistakenly invited Kevin in to give an update, but obviously he's here for the CAMS item later on. But the reason I've suggested Kevin, of course, because he's a key support to the Health and Wellbeing Board, where we've been providing updates on coronavirus. But perhaps I could invite Sharon to add anything else. I know we've been doing a lot of work, for example, with the university. So perhaps if I could invite Sharon just to come in and just give an update on what we've been doing working with the university.
Yes, we've been working with Brunel University, but also Bucks University and also Uxbridge College, because as places of higher education and further education, we have four-way meetings fortnightly where we look at the various aspects of the work that they're actually doing with regard to COVID-19. All of them have got their own preparations and local outbreak plans for their situations. I think one of the things that we've noticed, and all three have confirmed, is that when they're doing contact tracing, they stay within the confines of the university. So we're going to have to talk to the NHS Test and Trace to find out what are they doing overall in terms of contact tracing. So if the students go outside of the confines of the university, they've got to do that contact tracing, because the universities do not have the capacity to follow what has happened outside of the university. So this is something that we have to discuss with them. One of the universities has done a survey, and they found amongst students that only about 41% have actually been contacted by NHS contact tracing to say what have been your movements. So we do need to follow up on this, because this is a remiss on that aspect of the National Contact Tracing Service. They've got very robust systems in place for ensuring that the universities are COVID secure. If students need to have food packages, etc., that can be done. But once again, those students that aren't on campus, there's a gap there. So they will be, one of the universities, Brunel, will be talking to the local authority about what arrangements are in place for anybody who's vulnerable, whether or not they're a student or not, who may need some input. So those discussions are going to be had as well. And to a certain extent, they've been contacting other universities to find out exactly what's happening with regard to their arrangements as well. But so far, and I don't normally say touch wood, but by the grace of God, their numbers are very low at the moment in terms of positives.
Okay, thank you, Sharon. Thank you, Sharon. Before I invite colleagues for questions, there's a couple of quite higher level questions that I'd have. One is, how do officers assure us that the voice of Hillingdon is being heard at the regional London level, so that if we were to advance to a next level, it wouldn't be inappropriately applied, because our rates, for example, might be substantially lower than elsewhere? Or do we not have that freedom? So that's one, is around our influence at London level. And the other one is around the granularity of the data, that residents contact me. I've had a number contact me about, can we provide more detailed information about the prevalence of COVID by ward? And can that be done? Or yes, let's leave it at that point. Can it be done?
So if I could come in on the first point, Chairman, the decision has been made to, this is really very much central government working with the London Mayor, that will apply a London approach to the categorisation or the COVID alert level. Now, notwithstanding your point that actually there may be some boroughs in London which may have very low infection rates, but there's been a considerable discussion about this, and the general view is that many Londoners travel between different boroughs for work, for school, for leisure, but also many Londoners don't actually recognise the boundary differences, and therefore that's why the decision has been taken to apply a London-wide sort of COVID alert level at level 2. I think in many respects, we're keeping clearly a very close eye on matters with the current infection rates, and it seems to be at this point in time stabilising. I don't want to sort of wish anything upon us, but I do hope that all the measures that are being taken now will start to stabilise and hopefully start to reduce that rate in growth and start to bring it down. But I think if we can, Councillor Edwards, if we were overly concerned about any restrictions being applied to Hillingdon, which we felt were perhaps disproportionate or inappropriate, then we would make representation. But I think where we're at the moment, we feel that it's perhaps not inappropriate to be in tier 2, given that our infection rate is where it is at the moment, which is just over 100 per 100,000. The highest in London, I think, is about 150 per 100,000 at the moment, and the lowest, I think, is of the order of about 75 to 80 per 100,000. So we're not, when we get to that sort of infection level, then actually we do need to be thinking about taking extra measures. But it's certainly one that we're keeping a review on. Sharon,
thank you, Dan. About the data.
Sharon, could I ask you just to jump in on the sort of the position with the data, and I can add anything that I can.
Yes, we do have granular data that is available, and it does go down, I believe, to ward level. So we are aware of across the piece of what the levels are within and the number of cases within each ward, but we tend to give a borough-wide picture. But we use that information, the more granular information, to see where we might need to do more targeted messaging, or where we might have to do pop-up testing sites, so that we can get the testing into that area where the number of cases has actually risen, so to make it more available for residents there. And there's a lot of liaison linked to the data that we've got, that we're finding, to provide information to community groups, etc., in the relevant areas.
Thank you. If I can just come back on that, Sharon, if you say the council has that data, does the council have that data on the understanding that it isn't made public, or is it just not shared at the moment?
I think in the main, when we receive the data, it's stated, because they're always, from Public Health England, they're very keen to make sure that the data is clean. So they've got to make sure that the data is validated, and the reports that we receive, it states that this is not to be publicised.
Thank you.
We can give high level, but it's the granular information that's more difficult.
Okay, so at the operational level, we have a good understanding, but because of the constraints placed upon us, that cannot be shared publicly. That's fine. Thank you for that, for clarifying that. Councillor Egginson, we'll invite you here, and then Councillor Gardner.
Thank you, Chair. There were a couple of things. One was I was going to ask the same question about wards, and whether it would be possible to share it with councillors on the basis that they don't pass it on, because at least it would be useful when, from our point of view, to at least know what risk there is in our wards. But particularly, I was going to ask about the tracing system. We have, you mentioned, I think, Sharon, that there was a significant, or maybe it was Dan, mentioned there was a significant amount of testing, and clearly there was also requires a lot of tracing. Do we know the numbers of traces which have been initiated within Hillingdon, and do we know the percentage which have been successful, and also the speed of the results of the testing? So it's a number of things. Sorry about that.
Sharon, shall I just jump in and give an update on what I know, and then if I miss anything, then you can sort of add to that, if you don't mind.
Okay.
So in terms of, so just to explain the sort of track and trace service, so almost like the first stage is led by the NHS, and in Hillingdon they're achieving about 70% of sort of reaching those contacts, those named individuals that have been given to them who test positive, and so they're achieving about 70%, and so usually that's within about 48 hours that they're achieving that sort of level of contact. In terms of the model that we're looking to set up, I would describe it really as stage 2 in terms of our local testing. So, and the plan is that if the NHS are unable to contact somebody within 24 hours, they would then pass their details to us. And obviously time is of the essence. So what we plan to do is to, with their contact details, ring them, say 2 or 3 times. If we don't make contact, then the plan is that we will dispatch somebody to go to their home address and door knock, so that we can sort of get to them as quickly as we possibly can. And then obviously advise them to self-isolate whilst they seek a test.
Thank you, Dan. Sharon, is there anything you wish to add on that?
No, I think Dan's covered it all.
That's fine. Councillor Egginton.
Yes, I did ask a question of the numbers as well of tests, and also the tests really.
So in terms of tests, we're achieving about 350 tests per 100,000 population per day, and so I mean, if you very roughly, that's about 1,000 tests a day, which, and that, as I said earlier, that places us as the 3rd highest in London for test rates. So that's quite good, but obviously we need to have the agility to respond to an increase in infection, therefore an increase in demand for tests, which we can do if that's required. Across London, for example, if there is a particular hotspot, extra testing can be mobilised to hotspot areas.
Excellent, thank you. Councillor Garner?
Good evening, Sharon. This is for you, actually. You said that you've been speaking to groups in certain areas. Which community groups have you spoken to or approached in Hayes? Because I'm concerned that we've got a lot of people who haven't got access to computers, so they can't log on to the website to get onto they can have tests. You know, I just think somehow people are falling through the net. Have you been in contact with a lot of the community groups?
I've been to 2 of the sessions, they're very early on, but Fiona Gibbs is in constant, and I think Dan will be able to fill you in there because he'll know more. But they've a range of groups, including faith groups as well. Whether or not they're in Hazel, I wouldn't know the geography of it, but Fiona Gibbs would be able to provide you with more granular information around that. And also comms has been sent out. And one of the key things that came out from those discussions was how they would like to receive information. And actually it's not via the written form or whatever, they actually prefer it to be verbal. So it's almost cascaded through communities. So for example, with the Gurkha community, they said that that's how they prefer to get their information, but it's done by word of mouth. So we're trying to fit the messaging around how individuals communities would like to receive that information. But as I've said before, Fiona Gibbs will be able to provide you with more information around that.
What I can just add to that, if I may, is that what Fiona Gibbs and Marion Finney from the housing team did at an early stage was to hold a couple of sort of Zoom meetings or virtual meetings, and actually discuss with faith leaders and community leaders what is the best way to communicate, exactly as Sharon said. So what we've been able to do is provide the messages to those community leaders, and then they can then tailor and deliver those messages in the best way that suits their community group. So it's about 150 community leaders, faith leaders that we've got that we're able to push out messaging to. And as Sharon said, some it's more appropriate to deliver that message through word of mouth, and that's formed part of our wider sort of communications and engagement strategy, which has included, as you would imagine, social media and targeted social media towards younger residents as well, teenagers and young adults, along with posters, lamppost banners, information on our refuse trucks, Hillingdon People, the website, etc., etc., etc. So we've tried to saturate really the messaging, but also target it to those community groups.
Thank you, Dan. Councillor Hagger?
Yes, thank you. I'm a little bit concerned. I'm going to follow on from Councillor Gardner actually here. I think we've done amazingly well with our test areas and things like that. but I am concerned over the communication and engagement and the governance as well about what we are meant to do and what we are not. I'm dealing with a lot of disabilities, and I don't think it's been clear on the disability. I think the disabilities we could do better with, and somehow put it across to the disability sector. And the reason I'm saying it that is like charities and other groups, not just the interfaith groups and the churches network, but also the charities. And as we come into tier 2, it's particularly what people are meant to be doing. And I would like to have, I think we could really benefit ourselves by having a little bit more of a clearer understanding on what people are fearful and could go out but haven't actually, because they are not understanding the regulations. Now, I can only speak for myself that I struggle understanding what each of the tiers are be doing myself. And yeah, I just wondered whether we can make that any clearer, Chair.
Thank you. So, Dan or Sharon, can you assure us that the community groups that you are disseminating information through include our main support service charity, third sector charities?
Yeah, I certainly can say that we've delivered the information through the coordinating group, which is Hillingdon for All, and they've disseminated the information. But I do take on board what Councillor Hagger is saying, because it is a fast-changing environment. And actually, we've all of us have been bombarded with information over the last 6 months, and we have attempted through our communications team to clarify exactly what the tier 2 means. But I think, like anything, we all need to say it 7 times, I think, isn't it, before it really starts to sink in. But I think, you know, we recognise that. But what I will do, Councillor Hagger, is double check that our those groups that represent adults and children with disabilities are receiving the information, and maybe we should hold a special sort of virtual meeting with them just to give them the opportunity to ask any questions or clarifications.
Can I just say, Chair, sorry, just quick, because I do think it's important. Sorry, Chair, and sorry to interrupt you. One of the reasons being, I'm only speaking personal experience, but I think this is very important in this case. I have 2 children, different, one at college and one at a school, both who have been in contact with someone with COVID, and they've both been given different rules of coming back and isolating. And I think we need to really get this clear. So one of them, who's at college, only had to isolate, I forgot now, I think it was like 7 days, and the other one had to isolate for 10 days, both in the same situation. So I do think it's unclear.
Okay,
come in, Sharon, on that one you've indicated.
Okay.
Shall I? I'd be interested to know where they're getting the information from, whether it's the Department for Education, the London Coronavirus Resource Cell, or is it from the local authority?
Yeah, so I don't know, Sharon, because this is from the school. So one's Uxbridge College and one's the school. So I haven't asked. I've had a letter from the school, one from the school, one from Uxbridge College. In both instances, saying different things. Yet both the children have been in contact with someone that has COVID-19. It has been tested positive with COVID-19, and that worries me, because I'm sitting here and I'm like, well, okay, one of them's off and not allowed back till the following week, and the other one's coming back sooner.
Yeah. Neither of those days of periods of isolation ring a bell with me, because it's either 10 days if you've actually got COVID, or 14 days if you're supposed to be self-isolating. So I suspect, because this has been happening for the past couple of weeks, we've been getting, how can I put it, information that might need to be tightened from the Department for Education, and we've had to report it, and we've been asked by Public Health England every time this happens locally to forward that the areas of concern back to Public Health England, who then will challenge, with a small c, the DfE to tighten up recommendations that they give. But this is not a surprise. We've had it for a couple of schools have contacted our Public Health Department to ask for advice, and you can see the discrepancy there with what the advice should be. So if you're able to drop down in a bit more detail, that would be very useful, because we could then follow that up with the London Coronavirus Resource Cell. Thank you.
Thank you, Sharon. That is most helpful. On that issue, then, I think we should be inviting officers to take whatever steps they can to ensure that consistent criteria are applied by schools and colleges and places of education, because we have some experience of different measures being applied, and that just adds to what is a confusing picture. Councillor Garley, I believe you indicated?
Yeah, I'm sorry, I'm going to go back to the community groups with the greatest respect, Dan, to people who are speaking to the hierarchy of the faith groups. I don't deal with the hierarchy of the faith groups. I deal with people that are isolated at home. I deal with the mums. Is there any way that people can start speaking to them? I'll give you a list of names and addresses for people to get in contact.
Councillor, I think I really need to answer on this point. I think the council cannot take on the responsibility of communicating individually with over 300,000 residents. I mean, that's just not achievable. What we do have is an appropriate infrastructure for sharing it through the community groups, and we also have councillors who have access to all of this information on the council website, and we are equally able to disseminate it. And if your mums don't have access to this sort of data, you can share it with them, because we do have access to it ourselves, and you have been provided with the IT equipment to access it. So I really don't think we can be allowing or asking officers to take steps to speak personally to residents. Anybody else wish to ask a question here, please? Okay. There are nothing else there, so thank you, officers, for your contribution on the COVID. We are now going to turn to some far more mundane point of the meeting. So I will not be offended if those that are complete now leave the meeting. We're going to agenda item 7, the update on community and child mental health services in Hillingdon. Kevin, I believe you're here, and Kate, you're also here. I don't know who's speaking. One of you, please go ahead.
I'll make a start then. So I'm presenting, I'm just going to talk through really around adult mental health services. So the agenda item was the community mental health services. And just really wanted to talk through that the majority of mental health services in Hillingdon are provided by CNWL Mental Health Trust. And these are the range of health and clinical services that are available to residents. So, for example, the community mental health teams that we have discussed previously in POC are now clinical teams. Single point of access, the primary care mental health teams that support the GPs in relation to managing people with mental health issues. Talking therapies in Hillingdon, which people are able to self-refer to or be referred to for more specialist support. The crisis and home treatment teams, psychiatric liaison teams that work within A&E, for example, and early intervention services. So that's just a kind of brief overview on some of the some of CNWL's mental health services that are provided. As I say, they are clinical and health services. In terms of the council's role in those services, it really is around recognising those services are there and referring and directing people towards them. We're not involved in the commissioning or direct service delivery of any of those services. We would, of course, have some responsibilities through our overarching safeguarding responsibilities for all services in the borough that we talked about at previous POCs in terms of the work of the SAB. In terms of the council services, statutory social work, since the disaggregation of the integrated community mental health teams, that's come back under adult social work. So people with mental health issues would have the same, are subject to the same legislation as any other resident group in relation to the statutory social work services. So it's the Care Act, Mental Capacity Act. The adult social work team assess people's needs where they may have social care needs. We support plan. We would offer carers assessment to the carers of people with mental health problems, exactly as we would with any other resident. So that's been a change since we last spoke to POC, as previously those services were part of the community mental health teams. In terms of statutory services, the one distinctive area is around AMP, so that's the Approved Mental Health Practitioner Service. That is a council statutory function that is provided by the social workers, a specialist social work team, and they are the individuals who would undertake Mental Health Act assessments, which is the means by which people may be detained where they require inpatient mental health care. In terms of social care services that the council deliver, we do have some specialist supported living for people with serious mental illness. We also offer a floating support service to help maintain people in tenancies. And then there's a range of voluntary sector support that is provided through the council, including social inclusion, peer support, employment. There's a specialist welfare benefits advice for people with mental ill health, and we offer a range of statutory and non-statutory advocacy services, as well as some dementia-specific services such as the Admiral nurses. So that's a very brief overview of mental health services. As I say, in terms of the council, there's not a specific mental health service. It is around those statutory provisions that sit within adult social work and that range of more early intervention type voluntary sector contracts that we offer.
Thank you, Kate. Colleagues, any questions at all to ask around there? No indication. Kevin, is there anything that you wish to add at all regarding the adult mental health services?
I've come prepped to talk about the children's side, so the CAM side, if you're ready.
Fantastic. I will let you speak about the CAM side then.
Okay. Well, I mean, I think as Kate has just said, that the nature of mental health services are that they relate largely to services commissioned by external partners, and CAMS is a service commissioned by the CCG at the moment through Central North West London NHS Trust. And it's been an issue that this committee, I think, has looked at in the past, and certainly the Health and Wellbeing Board have been very, very keen to keep an eye on. I think about 4 or 5 years ago, when I first became involved in the subject, it was a great concern that a lot of young people in the borough were waiting longer than they should have done to receive the sort of treatment that they needed on CAMS. And the figure that was quoted is the target to receive support within 18 weeks. And they have an 85% target, and CNW were not reaching that for a long time. For the last year or so, they have been reaching that target, and I think we've come a long way in that period of time. What we've done as a local authority is to work alongside the CCG and our other partners to try and look more closely at some of the supporting structures and services that prevent people from needing to have to go to the more significant and more expensive, it has to be said, services that are offered by CNWL. So we've introduced through a local transformation plan, which was agreed by our Health and Wellbeing Board and has been updated annually, a number of different approaches. In particular, we've looked more closely at early intervention and the support that we can provide for people more upfront, so we're upstream. We have 3 services in the local authority that we've commissioned through our public health funding. One is called KISS, which relates to sexual health services. There's the LINK service, which is early counselling, and there's another project called Sorted, which deals with addiction management, and they're embedded within our youth services and based down in Fountains Mill, and supports young people. With the CCG, what we were able to launch about 2 years ago is a project called Couth, which provides online support for young people and access to counselling. And that's been hugely successful in reaching a lot of younger people that haven't otherwise been reached, particularly those from Black and ethnic minority communities. It's available. I thoroughly recommend it. It's a good website to look through. If people can self-refer there. We promoted it through schools, and we've seen the take-up through that service increasing quarter on quarter, the number of people who actually access it. And the last quarter I looked at, it was about 650 people had accessed the website for advice and support. So it's more than, it's not just a website you look at, you can interact with a counsellor to get advice through that. So these systems have been put in place to try and reduce the burden of people waiting, and then finding probably that they may well be disappointed when they finally get to receive the CAMS service, that they might not quite meet the eligibility, or that it was the wrong service for them. So through a multidisciplinary team and the early intervention project that we've worked on, we now have a much more structured way of reviewing young people who are perhaps not meeting the threshold for CAMS or being going through that process and then wondering what the support is thereafter, to look at this in a multidisciplinary way, as I say, working with CNWL, working with the voluntary sector, particularly P3, who are an agency who've been able to generate an awful lot, a significant amount of investment through the Department of Health and Social Care to launch this early intervention project. They've been targeting areas in the south of the borough, around the neighbourhoods, the one that's called Colne Union, which is effectively usually in West Drayton, but also Hayes and Harlington has been the areas of the greatest need in the borough. So those projects have been looking at young people with particular needs to try and identify what referral routes may be otherwise available to them short of CAMS. And I've got a list in a report that talks about from 68 referrals, those who've gone on to so many different agencies, whether it be, you were talking earlier about partners we have with HACS and the Centre for ADHD and ASD in the north of the borough. They've received referrals. The Alcohol and Addiction Service have received referrals. Links Counselling have received referrals, as well as people receiving support through P3 and others. So we're more confident now than we've ever been, I think, that actually there is something now available for young people who meet that early stage of need and are being supported and directed to appropriate areas. I wouldn't say it's been entirely cracked yet. There still will be issues, and the Wellbeing Board will be receiving a report at its next meeting on the 1st of December, which will include some explanation of what's happened really over the COVID period, because we certainly know that from talking to our partners that mental health services have seen a large increase in demand over that period. So and we know they've responded as flexibly as they can by moving to online support and such like, but the Wellbeing Board report on the 1st of December will cover the variety of this provision and talk about the plans for moving forward.
Thank you, Kevin. Very helpful update for us, and we look forward to reading the report in due course. The move to early intervention has to be right, not only because it is often cost effective to do that way, but it's actually morally right, and then it helps people at the earliest stage before problems become too acute. One of the issues that I do hear from, though, are the schools' difficulty in securing early intervention support. What assurance can you give us that the council has the capacity to meet the demand from schools who are looking for assistance with young people with mental health challenges?
I can't give you assurance that the council has capacity to meet the demand from schools. What I can say is that we're working very closely with the schools to direct cases, young people who need the support, to the agencies that are there and able to support them. They'll be in the voluntary sector, they'll be in the statutory sector, they'll be in the health sector, and they'll be some of the ones that we support directly through our public health grants. And that seems to be working. It's certainly a lot better, as I say, than it has been in the past. And we are seeing a reduced demand on the more expensive services in the CAMS area as a result of that, which is enabling them to meet their target.
Can I just press you a tiny little bit more then, because it is right that the council isn't there to meet every need that's presented, and it couldn't possibly do so. But at the end of the day, if there is a mental health need and a school or a parent needs some assistance, who owns the system to ensure that they get that support? Is it the Health and Wellbeing Board?
I would say so. Ultimately, that's where the accountability lies, in terms of being able to pull together different partners to lead the system, to make sure the system is working. And in many ways, that's exactly what it's been doing in looking at the local transformation plan that was put together. The lead for this, the commissioners for CAMS have been the CCG. We've worked alongside them to understand the interactions with council services to try and make sure we align as much as we can so that it's effective. So yeah, I think the full report to the Wellbeing Board should cover some of those areas to point out how it all works really.
Okay, and being a health issue, that is something of which we have an overview and scrutiny of. So if we wished to explore further, that is something that you could assist us with, is it?
Yes, I think. I mean, I'm happy to help in whichever way you want me to. Obviously, we would do that. But I think that there is a fuller story. You haven't taken a written report. If we wanted a fuller report, then I would commission that from our colleagues at the CCG. I'd work with them on it. This is what we've done for the Wellbeing Board reports, really, to make sure we present as positive a fuller picture as to where things are.
That full report will suffice. That's fine. It was just more of an understanding of where we sat and who ultimately is the person responsible, or the organisation responsible for ensuring that these demands are met. Otherwise, we end up pushing pillar to post to get something solved, which is a common comment I hear from people. It's not my department, it's somebody else's, and they just get moved around and round and round until somebody maybe sorts it out. And it's who do we hold to account for sorting that out? And you've been clear, and that's helpful. So thank you. Colleagues, are there any questions you'd like to ask Kevin? Councillor Hagger, yes, you've indicated.
Thank you, Chair. I'd just like to say congratulations, actually, on the report. I mean, it is amazing to see that we've managed to keep everything going as normal. So I'd like to congratulate the team, first of all, to say, well done. It's been an incredible, difficult time. And yet I'm reading in this report that you've gone to Zoom and you've gone to all those areas and we're still connecting. And I think that is so important at this time. The only thing I'd just like to say, I think our Chair said quite a bit actually of what I was going to cover, but I just wondered whether we have anything in place, or whether we are thinking of having anything in place for our prevention or indicators for our children and young adults. And I use that term loosely for both of them. I think we all agree that they have had a massive shock and a change. Learning Hub is very difficult on Zoom. It is not easy, or whatever they're using. They're in and out of school at the moment. I think we would be not mindful if we thought that would not have an impact on our children, as you said, Chair. But I'm interested in the early prevention signs that we might be able to put in place to assess whether there might be an issue for a child. Now, the reason why I say the early intervention signs, because most of us know that sometimes children don't get there until it's too late. And I'm looking at the early intervention signs now that people could put in place right now. Thank you, Chair.
Thank you, Councillor. Kevin or Kate? This is more Kevin, I think, sorry, than Kate. It's been children related.
Yeah, I would point to the early intervention project that we have up and running. Which is to say the one that's led largely through P3, but works very closely with CNWL and COOTH and the other projects I mentioned. And the fact that we are now trying to bring professionals together to look at cases separately. So there should be, the phrase that the project uses is that they are expanding the front door. There is no wrong front door. So if referrals want to come through, they should be able to go through schools, through to this hub that will look at what options are available, because all of these needs are very, very different. It's a bit like the conversation you had earlier, I think, in that it's not a clear linear path through to a CAMS assessment. There's a lot more that often can be done early on to support people. It might just be offering some sort of positive activity for somebody to support them while they're going through a difficult time or something. And that's the sort of thing that we can do with the voluntary sector, and that is up and running and it's happening now. And what I haven't got is an absolute up-to-date report from services in terms of what's been managed over the last couple of months. So that I'll have that in a few weeks, because it's being compiled for the Health and Wellbeing Board.
There is no requirement for you to have had that information tonight, Kevin. This is an update. We're very grateful for you to provide that update, but we do welcome the report that comes, and once it's gone to the Wellbeing Board, we will have a quick look at it as well, I think. Yeah. Any other questions, colleagues? Okay, thank you, Kevin. Thank you, Kate, on that one. We're now going to go to the next agenda item. I've lost track of my numbers. Corporate agenda item 8, the corporate parenting panel minutes dated the 17th of September. Councillor Makwana, these are the minutes that you and Councillor Eglinton were present at. Is there anything that either of you wish to draw out our attention to?
Yes, please.
Oh, okay.
No, you go first. After you.
No, I was just going to say that it was with regards to the safeguarding report that we had with Alex Coleman at our last meeting. Everything has been reflected accurately in the minutes, and just that we're now looking in terms of the work programme to have more themed meetings, as it says there, about safeguarding, health and education. So, yeah.
Right, thank you. Councillor Eglinton?
Yes, I was only going to mention that Councillor Dennis, who's shown as the chairman, is actually the co-chairman with one of the children or young people. And perhaps it should be reflected as such. Doesn't need to name the individual involved, but it should at least kind of note the fact, I think.
We absolutely, we can take that on board and ensure that in future it is shown as co-chairman and not just chairman. Okay, thank you. Anything else? That being the case, the minutes noted. Great, no dissension. Agenda item 9, the Social Care, Housing and Public Health Policy Overview Committee Forward Plan. We have that. Any observations, comments on this one, colleagues? Fantastic. Agenda item 10, our work programme. Liz, do you wish to say anything at this point on our work programme? Everything going to schedule?
Yes, everything's going to schedule as far as I'm aware. We are going to have somebody coming from HACS next time. Somebody will be attending from HACS in relation to the autism review. So that will be interesting witness. And in terms of other things, we have got a number of reports coming to the next meeting, which are set out in the work programme that you've got in front of you. So there's nothing really else that I need to add unless any members have any comments.
Okay, any questions, colleagues, comments? No, excellent. That, I believe, takes us to the end of the agenda. Thank you once again to our witnesses for giving up your time and sharing your experiences with us. Thank you so much. Thank you very much, everybody, for your attendance this evening. The meeting is now closed. Thank you.
Okay, I'm just going to close down the stream now.